Hello, and thank you for viewing our presentation, A Tale of Two Case Studies, The Impact of Environmental Hazards. Humans constantly interact with their environment. The World Health Organization defines the environment relating to health as all the physical, chemical, and biological factors external to a person and their related behaviors. Environmental health exists to control or prevent disease, disability, or injury relating to interactions between people and their environment. This model, commonly referred to as an epidemiologic triad, demonstrates agent, host, and environment as having equal influence in regards to disease causation as presented by the CDC. We will compare two case studies that demonstrate how negative environmental factors can impact a community. Case Study 1 is the pollution at Toms River, New Jersey from 1952 to 1994. Case Study 2 is the Pennsylvania fracking water contamination. Toms River is a township located in Ocean County, New Jersey, along a river by the same name. Previously referred to as Dover Township, the approximate population currently is 92,000. In the 1950s, a chemical dye manufacturing industry, Ciba-Geigy, opened a location in Toms River, eventually renamed Toms River Chemical. Initially, the community was excited about the jobs this large plant brought to their community. However, years later, the small town learned it came at a huge price. Between 1952 and 1966, Toms River Chemical legally dumped solid and liquid waste over 21 sites on their property, which eventually dumped approximately 5 million gallons of waste directly into Toms River, also the main public water supply for the town. By 1964, both the town's water company and Ciba-Geigy had evidence that the public drinking water was contaminated, but chose to conceal this from the public. In addition, approximately 40% of Ciba-Geigy's toxic waste was dumped daily into these sewage pits, which also seeped into the groundwater. Residents were not only exposed by drinking the contaminated water from Toms River, but also by water-to-skin contact and ingesting crops grown from contaminated soils as a result of this dumpage. The following year, the U.S. Army Corps of Engineers granted Toms River Chemical a permit to build a pipeline, dumping this waste instead directly to the ocean. The water company and Ciba-Geigy thought they had solved the contamination issue undetected. Residents became concerned about the chemical company and questioned if the building of the pipeline was necessary. It was even rumored the building of the pipeline was due to contaminated drinking water, but for the most part the water and chemical companies kept that information discreetly hidden from the public. It wasn't until the 1980s, when part of the pipeline burst at a popular intersection, that the town started to understand what was happening. The smell of the water was horrible. Also during this time, cancer cases were growing, especially in young children. By the mid-1990s, more detailed information on the water contamination was tested and reported. TCE and styrene, amongst others, were found in high quantities in the wells that supplied the public drinking water. These primary toxins are both colorless and cause chronic conditions such as liver damage, nervous system disorders, birth defects, and cancer. TCE specifically has been correlated with the onset of kidney disease and found to cause scleroderma, which is an autoimmune disorder that causes chronic hardening of the skin and joints, and decreased fertility and sperm quality in men. Styrene's adverse nervous system effects include decreased color perception, hearing impairment, decreased attention and memory, neurotoxicity symptoms, decreased neuron conductivity, and altered EEG scans. Vulnerable populations like infants, children, pregnant women, elderly, and those with already compromised immune systems were most vulnerable to be sickened by these toxins. From the mid-1980s through the early 1990s, Toms River experienced an increased incidence in childhood leukemia, brain, and central nervous system cancers. With the rising number of pediatric brain cancers, Toms River was officially declared a cancer cluster in 1995. As a result of this overwhelming disaster, Toms River has much more strict regulations, pollution oversight, and environmental health education. Although the public and government reaction was very delayed, the plant was permanently closed, and today the water in Toms River is declared clean. The site has inspections every 5 years to ensure there is no remaining contamination. Though the contamination of Toms River began several years ago, there is still more work to be done to prevent such catastrophes from happening in the future. To date, lab testing has not definitively confirmed the toxic chemicals released into the water cause the majority of cancers. And although many improvements have been made, there are still chemical agents and pollution practices that are underregulated and exposing citizens to dangerous practices that lead to disease onset. Case Study 2 involves fracking practices in Pennsylvania. Research done in 2015 and 2016 provided evidence connecting gas drilling and water contamination that occurred in Bradford County in 2010. Wyalusing is a very small town. The approximate population is 565 residents, and it's located in Bradford County, Pennsylvania. The Marcellus Shale, or sometimes referred to as Marcellus Formation, is located at the northern Appalachian Basin and runs across parts of New York, Pennsylvania, Ohio, Maryland, West Virginia, and Virginia. What is fracking? High-volume hydraulic fracturing, HVHF, or fracking, is the process of injecting liquid at a high pressure into subterranean rocks or boreholes as to force open existing fissures to extract oil or gas. Initially, the U.S. Environmental Protection Agency published a drinking water study citing that fracking had no widespread impact on drinking water. Gas industry claims promoted the same, that fracking is a safe practice and does not harm drinking water. Residents of Wyalusing disagreed. Despite federal and gas industry claims that drinking water was safe for the public, families in Wyalusing, particularly those residing along Paradise Road, began complaining of sediment found in their well water shortly after the construction of a Marcellus Shale gas well in 2010. Chesapeake Energy oversaw this construction, and subsequent testing revealed high levels of methane in the well water. As a result, Chesapeake Energy dug new water wells for the homeowners, but problems continued. Residents with wells still experienced foamy water, but lab tests were inconclusive to deem the water unsafe. Researchers found a new method to test the water that can detect chemicals at parts per trillion rather than parts per billion or million, which is typically used, and also more extensive than that used by the EPA at the time. It was then determined that in addition to high levels of methane, unsafe levels of the chemical 2BE was in the well water. 2N-butoxyethanol, or 2BE, is comprised of a family of glycol ethers and commonly used in metal, house cleaners, and paints. Methane is the main component of natural gas. The methane testing in one of the well waters was so high it was deemed at an explosive level and required evacuation. These chemicals can enter the body by ingestion, inhalation, and dermal contact. Residents, especially those who lived on Paradise Road, were exposed to high levels of these toxic chemicals via their well water. High exposures to methane can cause cardiovascular, respiratory, and neurological problems. It has also been linked to the development of epilepsy, pneumonia, and possible adverse birth outcomes. High-level exposure to 2BE over several hours can cause irritation of the nose and eyes, headache, metallic taste in mouth, and vomiting. Super high levels of 2BE ingestion causes breathing problems, low blood pressure, low levels of hemoglobin in blood, acidic blood, and blood in the urine. The silver lining to the discovery of this contamination is that researchers did discover a new, more complex method of testing water, along with the conclusion that gas migration happens. Despite research that the contamination may have happened before the wells were hydraulically fractured, Chesapeake was found responsible for the pollution of the well water and eventually purchased the homes of the residents of Paradise Road. The families have since moved away. The threats to our environment are still occurring. For instance, another Superfund site, also located in Bradford County, involves a 33-acre landfill full of hazardous waste. Since the late 1970s, residents reported odors coming from the site, which the EPA and Pennsylvania Department of Environmental Protection determined that past disposal practices caused contamination of groundwater and surface soil with volatile and semi-volatile organic compounds and metals. Cleanup has been ongoing since 1989. This Superfund site is one of hundreds of open Superfund sites in the United States. As Dr. Frank Dorman noted after the discovery of the Pennsylvania fracking water contamination issue, the EPA's protocols are designed around remediation, not discovery. What we have learned in evaluating both of these cases is that a more proactive versus reactive approach is needed for environmental public health practices. As a cornerstone of public health, the EPA should recognize that maintaining environmental health should be done with preventive programs and working alongside the populations they are trying to protect. Both of these studies prove there are laws that allow for environmental hazards, and the EPA should advocate for updated laws and regulations in accordance to scientific research. The Toms River case in particular serves as an example of how residents can take ownership of their environmental health and greatly improve their communities. This concludes our presentation. Thank you for watching. We look forward to discussing our findings with you on the discussion board.